For the past 8 years, the All Kenyan Moot Court competition has been keen on pushing the conversation on human rights within the Kenyan context. Through conducting various moot court competitions centered around human rights issues happening in Kenya, we've been able to engage with various stakeholders and, most importantly, law students from across the various universities countrywide to steer human rights discussions among students. This year will not be any different. Even with the COVID-19 pandemic that has changed what would be the old order to what is the new normal, we will hold our conference and moot court competitions to push the conversation around health and corruption. With a key focus on the Article 43 right, its realization, government response to the COVID-19 pandemic, and the malignant cancer of corruption that has over the years crippled the Kenyan healthcare sector. Join us virtually from the 2nd to the 5th of June 2021 as we discuss the theme, Combating Corruption in the Attainment of the Highest Attainable Standard of Health. All are welcome.
All right, good morning and welcome to All Kenya Moot Court Competition 9th edition 2021. We began yesterday and today we are having the third panel discussion where we're going to be exploring human rights violations during COVID. And my name is James Kimila, or Teacher Kimila as they like to call me, and from Amnesty, my good friend here.
I'm Emmanuel Famba Barasa, the outgoing president of the Kenya School of Law.
So, karibuni sana. This is supposed to be an interactive session where we encourage you to ask questions. Joining us in our panel today, we're going to be having Isabella Obara from IMLU. That is Independent Medical Legal Unit. We're going to be having Lucy Camuni from Office of the Ombudsman. And we're also going to be having Victor Chahal, who is a senior manager at International Justice Mission, IJM. And as we go by, we're going to be joined by Zipporah Abaki from CRECO, which is Constitution and Reform Education Consortium. So thank you very much. I invite my colleague to give us the context of our conversation today.
Yes, just to set the context of the conversation, we want to do an audit of government response to the COVID-19 pandemic and looking specifically at the social and economic effects of the decisions of government and the pandemic itself to the citizenry. We will want a conversation that looks out for the challenges that we have had, proposes solutions to those challenges, and then sees a way forward for Kenya and Kenyans going forward. So that is basically what we want to interrogate. We know that many people have lost their jobs. Other diseases are, not even getting a response from government, or there is still fear of even using the health facilities as they are. So we want to have a conversation around it and see what has it been, the year, how has the year been, how can it be, and how should it be going forward. Yes, back to you.
Thank you very much. So as you've heard, most of our panelists from the civil society organizations and independent institutions. So we're going to be looking at the role of civil society organizations as well as independent units in regard to COVID response. And I'd like to invite our panelists today to give us a formal introduction as well as their opening remarks. And I'll start with Isabella Obara. If you don't mind, please, you could unmute and also turn on your video so that we can see your face as you introduce yourself. There you go.
Good morning.
Good morning, Isabella.
Oh, it's nice to see you. How are you today?
Good.
We're doing well. Karibu sana.
Asante sana. As introduced, my name is Isabella Obara. I am an assistant program officer at the Independent Medical Legal Unit. I'm also the in-house legal counsel and I deal with casework specifically. And I'm happy to join this particular discussion specifically in terms of looking at the social issues that have been glaring in the face of COVID-19. And just to say something small, because from where I see it in terms of being a program officer at IMLO, definitely there are issues that have been glaring since March 2020 up until today, and definitely in terms of both social and economic, but I'll limit myself for this particular context, the social bit, specifically issues to do with security. And I'll talk about the recommendation as this particular conversation develops. I want to state that human rights is the founding board for the social rights that have been at risk in terms of enforcing matters COVID. I want to also reiterate that we know for a fact that COVID-19 is a pandemic, and we are aware that there are guiding principles for each and every state in terms of how they respond to any specific pandemic. This is something that we've not seen probably in the past 100 years or so. Someone should correct me, but we know that this is not something any of our governments probably in our lifetimes have dealt with. So definitely there have been glaring gaps that we will discuss as this particular conversation keeps developing. But my thing is that there are principles that guide us, and I don't know if we did well in terms of guiding them. Are there positives? Yes, they are there. Are we going to talk about them? Most definitely, yes, we're going to talk about them. But as we go on, I think I would want to limit myself to that and then espouse more in terms of the kind of work we've done, the specific documentation that we've done, and I'd be happy to share data on the same. So then once we are done with this particular conversation, we know that what we're talking about is specifically things that have been happening and not just rumors or hearsay or maybe propaganda. And I'm happy to be part of this panel. Thank you.
Thank you very much, Isabella. And just before I let you go, you've talked about cases that have come up during COVID. People have been talking about BC and DC, before COVID and during COVID. If you compare BC and DC, if you compare, the cases that you are receiving before COVID and the cases that you're receiving during COVID, from March last year to the moment, would you say there has been a tremendous increase in the number of human rights violations during this particular period?
There's been a staggering increase in terms of numbers. Definitely we knew that there are gaps because we work fully in the security sector, and definitely we have been advocating for police reforms, right? And so being in that particular sector, we are working with state agencies in ensuring that the security of the person, right to life, enjoyment of fundamental human rights freedoms. And so as we compare, the cases maybe from March, or rather say February 2020 going backwards, and then we look at now March 2020 to today, we know that there is a number. In fact, we give it a percentage of about 70%. We have seen different forms of police brutality. We are seeing people getting smarter. We've now noticed that outside of the usual beatings and shootings, we are seeing people being maybe attacked in their own houses in the name of enforcing COVID-19 rules. And we've also now seen the issue where people just disappear in broad daylight, and then we find them way later. Is someone getting smarter, or the system is allowing, or are we simply saying that COVID is now pushing people to disappear and reappear dead? Those are some of the questions that we'll be talking about as we go on.
Wow. Thank you so much, Isabella. I think there's too much to grapple with. And as we go by, we also recognize the fact that, the conversation that we're having today is not an easy conversation to have. We're going to be talking about things that are affecting our lives. We're going to be talking about cases and things that have affected our families and loved ones. And we will not, we don't want to be blind to the psychological or psychosocial impact of our conversation. So, I think, it's just important for us to mention that we are cognizant of the gravity of the issues that we're talking about, but we also recognize the relevance, the importance of us to talking about them, because we need to create a different culture and a different, to create change in our society. So thank you so much, Isabella. We're going to be coming back to you, but I'd like to invite Lucy Camuni from the Office of the Ombudsman. Lucy, how are you this morning?
My name is Lucy Dongo, Commissioner on Administrative Justice, and also the Commissioner disseminated access to information. I want to say that COVID-19 did affect the Commission on Administrative Justice, just like it affected all Kenyans, and we are alive to the fact that as a commission, we also had to adhere to all the rules which were set out during this pandemic time. And the Commission on Administrative Justice will normally deal with two acts of parliament, that is the Commission on Access to Information. We also deal with administrative justice, whereby we receive complaints from Kenyans from all walks of life. But today, we want to talk about access to information during this pandemic, whereby we know access to information is so crucial when people are not going to work, when people are not meeting face to face, when people need information real time, especially information related to COVID-19, information related to our health, information which was also affecting our economy, and information which was also affecting our relation as a country and as individual. So to us, we realized that access to information was more real during COVID-19 than any other time. And I must confess that we do commend all the agencies of government which came up with the way to work, the way to work out of the normal procedures. We were able to witness very fast action from the Ministry of Health, whereby they issued guidelines on how to work without meeting. They also issued guidelines on how to protect ourselves from COVID-19. We also found ourselves as Commission on Administrative Justice also issuing guidelines on how we implement access to information and other mandate of administrative or justice. To me, this is the right time to talk of what are the challenges, what is the way forward, what can we do as the pillar of one of the institutional commission which implements human rights under Chapter 4 of our Constitution. And I want to reiterate that everybody has been saying power belongs to the people. And power belongs to the people as enshrined in our Article 1, yet we have seen that this power, which is exercised by our representatives, the executive, the legislature, and the judiciary, cannot be utilized by Wanjiku unless the institutions like CAJ works as expected under the Constitution. That and more we'll discuss. Thank you.
Thank you so much, Lucy Camuni from the Office of the Ombudsman. And I think you raise critical issues about what your office has been able to do, but then rightfully acknowledge that there were challenges, and it would be important to talk about the challenges that were there as we move towards the future, see how best we can be able to be better. Thank you so much. We'll be coming back to you. I'd like for now to introduce our third panelist, Victor Chahal from IJM, International Justice Mission. Victor, how are you this morning?
I first wish to start by amending my name. My name is Vincent and not Victor. I'm going to be considering two questions. One, the space of civil society in providing oversight in the wake of COVID-19. And as I consider that question, the primary question I'll first be answering is, whose primary responsibility is it to provide oversight? Then we'll look at the space and what the civil society has been able to do. Secondly, police brutality. And as my colleague said earlier, we've seen a lot of increase in police brutality over this period. So the question I've been asked to consider, which I'll be looking at, is police brutality, where does it stem from? And we'll have a bit of a historical perspective so that we can understand where all this police brutality is coming from. So I look forward to a very engageful discussion. Thank you.
Thank you very much, Vincent Chahal, not Victor, Vincent Chahal, and thank you for correcting us. We are terribly sorry for baptizing you this morning. Yeah, and thank you for the introduction. You bring pertinent issues to this conversation, and I'd like to invite you, as you think about police brutality, if you could also think about what is it that needs to be done, so that we don't just talk about the problem, but we also talk about the possible solutions and what can be done to make things better. Thank you, Vincent. As I had indicated earlier, our fourth panelist will be joining us as we go by. That is Zipporah Baki. So once she joins, we'll be happy to invite her to introduce herself. But for now, I'd like to invite my friend and colleague to pose us with the first question.
Thank you very much. The first question, I want us to just start from where Vincent has left and try to respond to whose responsibility is it to really oversight, and what has the civil society done so far in oversighting government response, especially during this pandemic, including the many facets that you have brought to fore, ranging from police brutality, the question around hunger, for example, for individuals in informal settlements, and even individuals in just places outside Nairobi, for example. Questions regarding job creation and loss of work during the pandemic. So we'll start there with you, Vincent, then we could have a conversation with the other panelists as we go. Just maybe to lay the foundation on that issue, and then we will proceed from there.
To understand the issue of oversight, first I would like to say that in my considered opinion, we are in a situation where we have an oversight deficit. We have an oversight vacuum. And this is for the following reasons. But first, let me just lay a foundation on how come we needed a lot of oversight, especially during this period. If we trace our steps back and go to 2010, we gave ourselves a new constitution. Under that constitution, one of the fundamental tenets was to devolve power. So we devolved, we decongested, we decentralized, and we dispersed power from central governance to devolved system of governance. However, in order to oversight those on whom we dispersed power to, we then created a robust system of oversight under the Constitution. We strengthened our parliament as the supreme oversight organ, even expanded it as the supreme oversight organ, but we also did something else. We established under Article 249 constitutional commissions and independent officers. And their primary responsibility was threefold. The objectives was threefold. One, to promote constitutionalism. Two, to protect the sovereignty of the people. And three, to promote the democratic values and principles of governance. And so from 2010 to around 2015, 2016, we started having a deficit in terms of oversight. Parliament, to start with Parliament, in my view, Parliament has not performed well in that role. At some point, it became a creature of the executive. Secondly, the constitutional commissions and independent officers, whereas they started very well in providing oversight, at some point, it seems like they took a back seat. And therefore, the oversight was left open. And this is where civil society comes in. When Parliament decided to become a creature of the executive, and when constitutional commissions and independent officers, which have been given the primary responsibility by the Constitution to provide oversight, took a back seat, then it was left to the civil society. Now, civil society faced one handicap, and that is they do not have the statutory and constitutional power that these other public organizations have. And so, hence, my suggestion that we are having a crisis in deficit. Now, what does this lead to? It leads to a situation where public institutions and those who wield power, like the police, can then decide to ride roughshod over citizens, knowing very well that there is nobody to oversight them. The civil society has tried to fill this space. In fact, you have seen when we have cases about democratic values and principles of governance, about the sovereignty of the people, it is the civil society that is going to court, whereas you would expect it to be it's the primary institutions given that responsibility by Parliament. Even talk about the recent case on BBI, it was participation of civil society. And so for things like brutality by the police, it is civil society who are providing this oversight. By now, I would have expected the institutions with that primary responsibility to have summoned the Inspector General of Police, because they have power under the Constitution, Article 252, I think, to summon such people who wield power. And so this is the unfortunate situation we find ourselves in, and that's why I'm talking about a deficit in oversight for the reasons that I have cited.
Thank you. Thank you very much, Vincent. And just to tie in Isabella, how has that been for you? Would you still share the sentiments that have been given by Vincent, or has your experience been unique?
Thank you so much. I want to agree, in totality with what my colleague Vincent has spoken about. He has adequately covered issues to do with responsibility, and I do not want to go back to that because that is already cascaded or rather provided for in the Constitution. I want to limit myself to this particular question, specifically in terms of the role of civil society. And it is true, as Vincent has said, we do not have, as a civil society, the statutory power that would allow us to engage at certain levels in terms of responding to matters. And I hope you keep in mind that as civil society, we are normally mandated to various aspects of what it is that we do. For instance, the Independent Medical Legal Unit's mandate is to respond and to prevent torture, inhumane and degrading treatment. We also deal with issues to do with extrajudicial execution, enforced disappearance, and things like that. So you already see the issue that comes in terms of our role. So one, we do not have the statutory power. Two is that we are mandated in terms of what it is that we do, or rather what it is that we respond to. So having said that, you have an overview of what it is in terms of us as civil society to provide oversight, specifically to those issues that you deal with. I'll go back to what has been mentioned in terms of police brutality. Definitely there are authorities like IPOA that are then mandated to support entities like INLO and other entities, for instance, the ones that are in the police reforms working group. But are we seeing positive change? Are we seeing any movement? Are we seeing any sort of collaboration in terms of addressing the issues that have been glaring? And when I speak about that, I also want to talk about the adoption of the measures that Kenya has seen to be taking in terms of ensuring that they've curbed the spread of COVID. I want to talk about this specifically because we have numbers and we also have cases that would then answer to the question of oversight, role of civil society, and whose responsibility it is. So for this particular one, I want to talk about the Siracusa principles that guide most states in terms of how they respond. So for instance, the moment we curtail freedom of movement, or the moment we set up maybe a curfew or something, we have to have made sure that as a state, that this particular adopted measures is not violating any sort of human rights. And when I talk about that, we are looking specifically at the implementation of such adopted measures. Were they legal? Yes, they were legal. They met the legal threshold. But how are they implemented? And that's when we saw the issue of curfew, deaths, so to speak. We saw a rise in terms of corruption, probably where there were roadblocks and whatever. So with saying all that, I would want to wrap up and indicate that there has been a deficit in terms of oversight. That is just the truth. The civil society will try as much as it wants to, but limited based on its power and its mandate, we are only able to go so far. So are we doing enough? Are we getting the support that we require? Are we ensuring that we are responding as much as we can? I think that's something we can share and hear what the other panelists have to say. Thanks.
Thank you very much, Isabella. And just a rejoinder with Commissioner Lucy, you're on the receiving end as a government institution, a constitutional body. What has the Commission been doing in response to a variety of things, including what Kenyans seem as an overstretch of even administrative action by the executive?
Reiterate and state clearly that as a Commission, as an ombudsman, we have not slept on our job. We have strictly adhered to our mandate. That is, the mandate mostly on access to information. And during COVID-19, this is the time we truly noticed that access to information was very necessary. And we provided a platform on how citizens would receive information during this time. And like I said before, we are guided by our Article 10, whereby we must ensure that there is public participation of the people. That is 10.1. It states clearly that participation of the people is key. Further, we are guided by the same article on the issue of protection of human rights, non-discrimination, and protection of the marginalized. We are also guided by good governance, integrity, transparency, and accountability. This obviously will enable development. As a Commission, we are also guided by Article 232, which states clearly that we must protect the right of the people or the sovereignty of the people. We must also ensure that we adhere to the Bill of Rights, where we are created as a commission. We must also ensure that all state organs observe democratic values and principles and promote constitutionalism. What have we done as a commission during COVID-19? First and foremost, we did team up with all other constitutional commissions, all other government officers, and agreed to follow the laid-down protocols. We were, as a commission, able to come up with guidelines of how we will be accessed by the citizen so that we can get our services. We communicated as was required. We were open through email, through all means, that is the social media, Twitter handle, Facebook, and we did indeed receive requests from the public, and these requests were processed. And we received requests related to COVID-19 pandemic, requests on how citizens were being handled by the Ministry of Health, how citizens were receiving treatment, and how they were even isolated. And in doing so, we were able to provide this information as and when was required. Further, I want to state that we saw implementation of access to information across all government institutions. We saw the Ministry of Health issuing statements every hour on pandemic. We saw the judiciary also giving guidelines using access to information law on how courts will be accessed. We also saw the COG, that is the Council of Governors, also coming up in the media, in the open, and providing information on how the counties will tackle COVID-19. At the same time, as a commission, when we realized that there were challenges at the time when certain information was not flowing from the national government and from the county government, especially issues of the usage of COVID funds, as a commission, we came up strongly and issued a circular to all government offices and requested them to adhere to Article 35 insofar as providing information was concerned. We also told them to come up with a proactive disclosure mechanism as provided by Section 5 of our Act, whereby they were supposed to account for the money received and utilized either from government or from loans or from grants, and tell us how they have utilized the funds during COVID-19. We also told them to specify the issues of contractual amount used or goods used, and we were also on record that the Council of Governors and other government institutions responded to us and told us that they are ready and willing to provide information. And if you look at most websites of government institutions, they are very active, unlike before, and they are providing information as and when it's required. And like I said, there are challenges. This is not the normal times, and we must all agree that as a country, we have done better than other countries in Africa and even abroad, more so because we were able to be proactively involved in the fight against COVID. For the other challenges which came about insofar as information was not accessed by the people in the rural areas, we were able to form, to enhance our regional offices, and we told them to ensure that our circular is circulated to each and every office at the county level. More so, I want to say that as a commission, we have teamed up, or we are in partnership with other institutions insofar as access to information is concerned, including media. And we have come up with MOUs, whereby we have signed with Media Council. We have also come up with MOU, whereby we have agreed to work with Kenya School of Government so that we implement a curriculum which will train government officers to ensure that they work within their mandate and they provide information as required. I think that's what I can say for now. Thank you.
Just a follow-up, Madam Commissioner, on public participation. There is a feeling in the public that what has happened is a citizenry has been converted into a recipient of basically executive action, ranging from executive orders from the President, action by Parliament on a range of issues, including taxation, to police brutality, so to speak, as Mr. Vincent had mentioned. What is your response to that, and what has your commission done to ensure that the actions that are done issued to Kenyans have participation from Kenyans?
Thank you. As a commission, we are also mandated to issue advisory opinion to all government institutions, and we are on record that we have issued advisory opinion on issues you have raised, especially issues related to human rights, police brutality. We have also carried out certain investigation internally as and when we have witnessed such brutality, and we are on record that we are members of open government OGP participation, and we have come up with NAP or action plan, which we want to ensure that each government office implements. That is, we want to have an open government, and one of the areas which we are looking at is that one of public participation. How are we ensuring that public participation is being undertaken as it should be within the constitutional framework? And we have teamed up with many counties, including Makueni, and the county of Nairobi has now joined OGP, and this is a platform. As a commission, we want to utilize to ensure that our government is open, and we also invite even the police or the agencies of security to be part of open government, and that one is working, and we hope that NAP4 will gain more than we did in NAP3. Thank you.
Thank you very much, Honorable Commissioner. I'll invite my co-moderator, James, to conclude on that and proceed to the next phase of the discussion.
All right. Thank you very much, Madam Commissioner, for your contribution. And indeed, you've shared more of the things that you've done as a commission, but also recognized, as I had said earlier, that there were shortfalls. And I'd like to give your co-panelists, Isabella and Vincent, a minute just to weigh into your response. And there is a general feeling that people are, access to information, which is a constitutional right, has been limited. And with that limitation, that has led to more and more violations of the rights because people are unable to rise up to demand for their rights. Part of it is because they are unaware of those rights, but then also there are limited access points to how they can be able to seek redress. So, starting with Isabella, do you feel like the Office of the Ombudsman has done enough to ensure that the citizenry have the relevant information in regard to the policy with which the government is using to combat the COVID pandemic?
Thank you so much. I would first like to commend Madam Commissioner for even joining us today. I know they normally have a busy schedule, and I'm happy just to hear from her in terms of some of the things that they've put up, in terms of structures, coordination measures, collaborative areas between them and other government agencies. It's quite commendable, but the question is, are we seeing the proper implementation or rather use of these structures? The answer would not be quite impressive. I know that is there, but from what it is that we receive is that there has been a barrier in terms of access to information, specifically what is going on. For instance, we have had cases where people were not able to probably access words specifically, so then they do not either record or maybe send out pictures. Just when you go to the grassroots level, right? But of course, when you cascade it to other levels, things would be different. So fine, the structures are there. Are we implementing this? That's the question. And do we have the financial muscle or rather resource muscle that is required to properly implement? And I know that we've always had issues in terms of, enhancing our relation with government, but we as civil society do not want to come off as people who are always fighting the government. But Madam Commissioner, I just want for you to at least tell us what it is that you're looking at in terms of ensuring that these structures are implementing what they're supposed to be implementing. Thank you.
Thank you, Isabella. Vincent, what is your opinion?
First, I want to join Isabella in lauding the Commissioner for narrating to us what the Commission has done. And probably it would have been better also to hear what other commissions have done, because collectively they are oversight bodies. However, I just want to make some few remarks on the issue of disclosure of information. Under the Access to Information Act, as Commissioner mentioned, there is provision for proactive disclosure of information. This is information that is supposed to be disclosed by public institutions, even without any prompting. I do feel, looking at the past 1 year or so, I do feel that inadequate information has been coming from government.
Within the law, that is the domesticate access to information law at the county level and reach wananchi. So structurally, we have put in the structure, we have implemented it, and one of the area where we feel that we open up public participation and access to information and providing of information by government office is by the curriculum which I stated we are working with the government, with the Kenya School of Government, whereby access to information or being open to the citizens will become a culture, or we hope to educate public public officers to inculcate in them the culture of disclosure, the culture of giving information. And this will not be done by CJ. It has to be done with other partners who will be actively educated by Kenya School of Government and Commission on Administrative Justice. I also want to state clearly that we also want to monitor online access to information, and there is a tool which we have developed. We want to implement it as soon as it's possible, and we do have officers who have been trained on the monitoring tool to check what government is implementing. On the issue of those officers who did not get access to hospitals, so to speak, we did receive requests, because you wouldn't know. You can't act unless you know. We did receive requests from such citizens, and we acted on the request. And we called certain hospitals, we even called government officers, and some were assisted. Some you may not know, and we have it on our record that we did act as and when the citizens were active and called upon us to act. And finally, I want to say that all social media in government offices have been active, and we must recommend ourselves that we are doing well in terms of providing information than before. I am of before. I know how it was 10 years ago and how it is today. With the constitution in place, we have opened up, and it is important that Kenyans recognize that we have moved from where we were, the culture of secrecy, and we are getting towards open government. Thank you.
Thank you very much, Commissioner Lucy, for your response. And I'd like to continuously thank our panelists for the contributions that you're making to this discussion, as well as the attendees. I can see some attendees who have their hands up, would like to ask questions. I'd like to notify you that we're going to be having a Q&A session towards the end of this panel discussion. There's also an anonymous attendee who says they have a burning question. If the question is very burning and you can't wait to the end, you can just type it out, then we'll see if we can pick it and share it with our panelists. But for the comprehensive Q&A session, we're going to have that towards the end of this panel discussion. So I know there's a hinting that Vincent made that he'd like to share more about police brutality and the history behind that. But before I come to you, Vincent, on that, I'd like first to go back to something Isabella had also hinted that there has been an increase in reported cases of human rights violations. And Isabella, as you share that, I'd like for you to talk also about the government's role in ensuring access to the right to health. We realize that the government has done, a commendable job in combating COVID together with the citizenry, but we also recognize that we did not put a pause on all the other diseases and infections. So there has been an increase in other communicable diseases and also other non-communicable diseases. We've seen an increase in the number of children who've missed their immunization schedules because of the fear that, when their parents take them to hospital, they're going to contract COVID. We've also seen an increase in the number of reported TB cases in the country. So what does government's role look like, or how well has the government ensured access to the right to health, even as you share the increased cases of human rights violations that have come through your organization, Isabella?
Okay, so I think we were having an issue with our internet over here, but let me keep it this way, so then I'm sure that we are able to communicate. In the event that you can't hear me, please let me know. Thank you for that question. I've noticed that you've tied that particular issue of the right to health, you've tied it together with police brutality. So I'll split the two and then answer accordingly. So in terms of the right to health, I want to admit that the government has indeed taken measures to ensure that the human right to enjoyment of proper health is there. The structures have been set, that I must admit. I mean, we've seen issues to do with specific areas being cordoned off. There were no travel, there were restrictions probably in terms of people going to bars, wearing of masks, ensuring that people get home in good time in terms of curfew. So that has been set. And that is commendable specifically because it goes to show that a government is aware that its people, rather the people have to be protected. The government is also keeping in mind that in the event that this pandemic hits, we may lose all our people. And we can tell that there is a recognition of the current health capacity that we have in terms of hospital beds, expertise, and resources. That is all right, and I commend them for that. However, now, these particular measures that have been adopted to ensure the highest attainable human rights to health have another implication, which I will speak to specifically in terms of police brutality. So yes, we are trying to ensure that our people are protected, but how are we implementing these adopted measures, right? And we understand that the right to health is closely related and dependent upon the realization of other human rights. That is something that we're cognizant of. So we really can't split probably health from the security of the person or maybe health from economic rights. So having said that, now let me speak to the issue of police brutality. And this is specifically due to the enforcement of the adopted measures. And we have received a high number, specifically between March 2020 and February 2021. And the issue of police brutality has been glaring because it denies people access to health. And I'll give specific examples. For instance, if one person is unwell, but they are not able to get past, for instance, a roadblock, specifically because they're enforcing maybe a restriction or maybe a curfew order, and this person loses their life, have we allowed them the enjoyment to right to health? There's a balance, there's a lack of balance in terms of enforcing the adopted measures and ensuring that the right to health is in place. And then we also have the issue of now forcefully enforcing, and we saw that people were being beaten, others were being picked out of their cars. We've had issues of shootings. We've also had issues of people being attacked in their houses way past curfew, in as much as they were not even violating any type of rule or rather measure. And so that then brings me to this particular area where we're now saying that the government is adopting measures, but are they ensuring that people are enjoying their health rights? Because now we are seeing an issue of twin crisis. Twin crisis meaning that we have the pandemic itself, and then we have the misappropriation, or rather the improper implementation of those measures as adopted. And when I speak of twin crisis, we mentioned the issue of people dying of malaria. We noticed an area where we saw people who are living with HIV and AIDS were not able to access their ARVs. And we've known that the number of TB, we know how many people normally die of TB. I'm told per minute it's more than 5 to 6 or even 7. Someone would give us the statistics. And I will be saying that as a government, we are going to specifically respond to COVID and now turn a blind eye to the other people who have other issues, probably say diabetes or cancer. Yeah. So I think in as much as we are setting up these structures to ensure that our people enjoy the highest attainable human rights, we then need to make sure that we strike a balance between that, the implementation of these measures, as well as all these other health issues that come outside of COVID-19. And this should be done with an appreciation of the fact that COVID-19 is going to be with us for a very long period of time. We do not know when. As long as one person in this world has COVID, then it is still around. How then do we balance that particular fact in mind to the fact that we have social and cultural rights that have to be enjoyed, we have economic rights that have to be enjoyed, and we also have to have state agencies maintaining law and order as well as security of the person. That would be my weighing in on this particular question. Thank you.
Thank you very much, Isabella. And moving on to Vincent. On the same question, I recently read an article that said that the government has treated Kenyans not as partners to be consulted, but as a defiant well, they said a defiant child, but I don't believe children can get to that level. I'd put a horse, I'd say treated as a defiant horse that was actually beaten to submission. So the article said, the government has treated Kenyans not as partners to be consulted, but as a defiant horse, quote unquote, that needs to be beaten to submission in its response to COVID. And it was a question about whether we are in a state of emergency in the government's pursuit to provide the right to health. Vincent, are we in a state of emergency? And what has the government done enough to ensure the enjoyment of the right to health?
Yeah, thank you very much. Are we in a state of emergency? The answer to that can be different. If we look at it from a legal perspective, then the answer is no, because there are parameters that define what would be a state of emergency. However, if you look at it from the understanding of ordinary parlance, then we'd say that if you are having a pandemic, then you have a state of emergency. I'm employing those words now in their ordinary meaning of terms. So I think, in my view, that the government has done moderately well in trying to combat this pandemic. I mean, we've seen even county governments doing the much they can to try and provide facilities. We've also seen information trickling down to Mwananchi on how they can, try and prevent the disease, which is important because we wouldn't know that we're supposed to put on masks if the government didn't say. And so to that extent, I think that the government has done well in trying to combat the disease. But again, at the same time, I think there's opportunity to do even better because, in my view, there's still room for a lot of improvement in terms of provision of equipment in our hospitals at different levels. Much as the government has tried to equip those hospitals at the county level and all that, but I think there's a lot of room for improvement, and it would go back to prioritizing, looking at this pandemic, and then prioritizing how we budget as a nation. How much are we willing to put into the health sector? So for me, I would think that in that respect, then there's a lot of room for improvement because we can budget more so that we have a healthy nation. I wish I had read the article, so I'm hesitating to comment on that quote that you gave because I've not had the benefit of reading the entire article. But that would be my response to this.
Thank you very much, Vincent. Rightfully said. And just stemming from your response, I'd like to go to Commissioner Lucy. How has the government ensured the rule of law in, responding to COVID? How has the government ensured the rule of law in responding to COVID?
Thank you. And I want to state clearly that the government has and is continuing to comply with the rule of law during COVID. How did they do that? As a commission, we did witness the guidelines which we saw being circulated in the whole Republic of Kenya. And these guidelines touched on all of us, and they were supposed to be implemented by not just one government agency, but all government agencies. What we did as a commission, we tried to put them on many websites as we can, and to ensure that this was done. Further, government has also to obey access to information law. Unfortunately, or as it should be, we do know that we have Section 6, which deals with limitation, which relates to national security. And within that national security protection, you may feel like certain activities are not happening, but they are happening, but not disclosed. So government is working very hard to try and contain pandemic, to try and ensure economy is going on or development is going on, to try and even limit police brutality, as you are saying, using the lay-down procedures, but that information is limited. It cannot be accessed by Wanjiku or Lucy. It is limited, and we can only kind of agree which one do you want and which one should be protected. And how does it happen? The same act provides that you can write to the institution, and if it is denied, then the commission comes on. That is how we have tried to protect the rule of law. And we must still remember that the Constitution is alive, even during COVID-19. Government must learn, Wanjiku must be protected, and pandemic must be contained. So the rule of law must be weighed always. You cannot bash without asking, what did you do in certain circumstances? Were you within the law? If you are not within the law, what did I do? And you felt aggrieved. Did they seek services from the relevant institution? That's what I can say.
Thank you very much. Thank you very much, Lucy. I'd like to invite my colleague to bring in some further questions from the public that are relevant to this conversation.
Sure. Now, there's one question that I'd want to ask, actually two questions, and then we'll move into the next sector of the discussion. And one of them is from a member of one participant who is asking about how, to what extent do we make sure that the recommendations that you have given from your office, Honorable Commissioner, are enforceable? How do we ensure that, for example, the guidelines that you have talked rightly about, you've issued to several executive offices, how do you ensure that those guidelines are followed? And in an instance where they are not, what is the fallback plan to kind of try and enforce them? Because then that looks like our only security to ensure that human rights are protected.
Thank you. Under our act, that is access to information, the decision of the commission or the determination of the commission has the force of law, like a court of law, and it is clearly stated. So if we issue a circular, if we issue a determination related to a request for information, that determination must be treated as enforceable of law. It is an order, so to speak, although I will not use the word order, we use a determination from the commission. And what we have done is ensure that such determinations or such advisory opinion are implemented. We do follow by calling the institution or the requester and ensuring that their request is given. If it is not given, we also have the right to go to court as a commission to protect now our mandate, and that is the fact, which we sometimes resort to when we have cases in court. Others, we have seen requesters moving to court using our letters or our determination to try and enforce our determination. That is how we try to implement our guidelines and our advisory opinions.
Thank you, Madam Commissioner. And just staying with you for a moment, there's a question on COVID-19 statistics, and the question is, I have a question to the Commissioner. Does the COVID-19 statistics form a part of the information to be withheld under Section 6 of the Act? If we could get a comment on that, and then we'll proceed to just explore the area of police brutality at length.
I want to state clearly that we have the data protection law, which is now in force, And within data protection law, certain information related to health is truly personal, and that one cannot be disclosed to the public. However, there is certain information related to COVID-19 which must be disclosed. That is like the usage of funds, the contractual agreements, and also the steps being taken by government to implement COVID-19. Those are enforceable under Section 5 and must be disclosed. But issues of personal data cannot be disclosed. That is what I can say to that. So we have two levels: areas which can be disclosed, areas which cannot be disclosed. Statistics, numbers can be disclosed, but not personal data. Thank you.
Thank you very much, Honorable Commissioner. And just to turn the leaf a bit to what Vincent had alluded to before, the conversation around police brutality, especially on the enforcement of the COVID-19 protocols over the year. And my question to Vincent would be, we have a history as a country of a lot of police brutality, including the use of torture, in maybe getting information to use as evidence in court, and many such human rights violations. But this is also a situation where the government is trying to limit the right to movement because we have to protect ourselves from a virus that they say cannot be seen. But to what extent then are the police then allowed to use force? And do you think that then they have a justifiable reason to use it to the extent they have in the past year?
I think we have many laws which are supposed to be implemented insofar as security, internal and external security is concerned, and I will only confine myself to access to information. The other laws are known, basing them on our constitution, and what we are saying is that police brutality should be condemned at all times. And the access to information, if you feel that you have been aggressed by a police officer through police brutality, you have a right to seek information and to ensure that that police is properly brought to book. That one, we are agreeable. We are also aware that under access to information, we are not supposed to work alone. We are supposed to also train policemen, security officers to know the limitation. How far is this limitation under the Act going to be? Because if it is somebody working outside the purview of their law, definitely they are not protected. And that is the duty of the Commission to train police. And the curriculum I'm talking about, it has a chapter on the limitation and national security, which we hope to partner with government agencies related to security. That's what I can say.
Thank you very much, Commissioner Lucy. And just to add to the question a bit for Vincent and Isabella, and we could start with Vincent, looking at police brutality as has been, and then looking at it during and before COVID-19, during COVID-19, and the work that AJM and IMLU has been doing regarding the working group on police reform. How is there progress? Have we made progress to, on that front, or there's still extremely sticky issues that we need to deal with that, even when we audit the 10-year constitution, we cannot see a lot of progress yet? Maybe we could start with Vincent, then Isabella will come in.
Yes, thank you very much for that question. Now, to understand police brutality is a difficult task because it has got historical perspectives. Yes, whereas it is true that we saw an increase in the human rights violations over the COVID period, but COVID and the enforcement of curfews just provided yet another reason for police brutality, and it has a long history, starting way back from 1907, when we had the first establishment of a semblance of a police force. And you find that this police system was established in a way that it was to protect the interests of the administrators. At that time, we had the Imperial British East African Company, an offshoot of the British East India Company. And the police had been established to protect their interests. And when you look at how the police system developed, you find that the training was, more emphasis was laid on paramilitary sort of training as opposed to technical training. Over the years, the police were used, even during the colonial times, the police were used to protect political interests. In fact, when you look at the state of emergency that was there in 1952, the police were used to protect political interests. And even coming to after independence, you find that the police were still being used as a political tool of suppression, and anyone who had other dissenting political ideas, then you would unleash the police to them. Even after the first regime and coming into the Moi regime, you still found that the police were trained that way, and that's why it was called a force and not a service, as the 2010 Constitution has now done. Because that was the thing. And so the philosophy within the police system, in my view, is that you protect the interests of the administrators. And so anyone, including the citizen, who goes against those interests, then he becomes a perpetrator in the eyes of the police. So that historical perspective is very important to understand that even as we are coming to the COVID period, there are systemic issues that cause impunity within the police. Other issues include, for example, ethnic hegemony. In fact, even coming to the time of independence, the top echelons of the police were all white. Yeah, and even after elections, you find that the top echelons of the police were people from ethnicities that the rulers considered they could trust. And in fact, it was even perfected much more during the Moi regime. And that's why in those days, and I still think even up to now, if you wanted to imitate how a policeman speaks, you had to speak in a certain accent, because there was a lot of, ethnic hegemony within the police system. So all these things looked at together, and the culture of force that has been inherent within the police system is what informs police brutality. And so when we came now to the COVID period, it just provided yet another reason why we would have police using force to enforce the curfew, because that is the language understood within the police system. So there are some things that we can do as a nation to try and change all that. But at the same time, it should also be understood that police work under very harsh conditions and under very poor conditions. Some of them have very poor working conditions. Even when we are seeing now them sometimes turning against themselves, they are working under very high stress levels that need to be managed. So there are fundamental issues that we need to address when we are talking about police brutality. And we need to understand it from that perspective, learn that perspective, and then see how do we deal with the systemic issues. That's what I can say about that.
Maybe just to stick with you, Vincent, for one more minute, and to look at it from, well, we have a very, very difficult history, so to speak, between the citizenry and the use of police force in enforcing whatever it is, ranging way back into before 2010. And what, while that is a standard we seek to move to, the standard of no police brutality at all, but have we improved in our accountability mechanisms? Are we able to hold police accountable successfully? And how does that then affect or help the discourse around the reduction of police brutality in the country, especially post-2010?
After 2010, the Constitution established an oversight agency, the National Police Service Commission. And the idea was to address issues of transfers, issues of poor working conditions within the police system and all that. Later on, we had IPOA being established by statute. to provide civilian oversight over the police. And so, in a way, the Constitution provided an opportunity for there to be improvement. For example, one fundamental thing was the fusion of the police with the KPS, the Kenya Police Service, and the Administration Police, which is fused in law, though practically it is still not used up to today because it has been difficult to implement that. And so, whereas you find that the constitutional platform has provided an opportunity for there to be a lot of improvement in that, but there's a lot that needs to be required. For example, there is need to put a lot more resources in training of the police. When we are doing recruitments, you find that more emphasis is placed on physical attributes and fitness other than technical expertise. So it is after they pass the physical test that they are then taken to Kiganja or whatever, for some technical expertise. So this poses challenges. So we have to make deliberate efforts as a nation and say we want to infuse more resources in their training. We want to look at to improve the qualifications, so that then we can get better service. However, if we just legislate and even establish institutions such as IPOA or the National Police Service Commission, but then we don't put in resources, even sometimes adequate resources to support those very oversight institutions, then it becomes difficult to improve the system. So that's what I can say. But it is unfortunate also that when you look at now where we are going, when you look at the proposals in the BBI document, you find that it will take us a step back as regards the police. Why? Because the main functions of the National Police Service Commission they're going to be transferred back to the police. So the police will be the main oversight over itself. And so that will be retrogressive. And hence why I was saying that yes and no. We've seen some improvements, yes, but no, because we've not put in enough to increase the technical capacity of the police.
Thank you very much, Mr. Vincent. I'll allow you, Isabella, to come in and just give your comments, and then I will add a question in the same discussion as we proceed.
Thank you so much for that question. I want to limit myself to the very first question that was posed to Vincent, because I know you've tabled other questions that maybe I could answer later. But first, I just want to talk about the balance in terms of enforcing probably a measure and taking care of the person you're trying to protect. And for me, I still go back to the principles I had alluded to, and when we're looking at how the police, because they are the key state agencies in terms of ensuring that we curtail the spread of this particular virus that has been upon us for a while. And some of the things I would want to mention is that as we are trying to ensure that our people do not succumb to this particular pandemic, then there are standard minimums that we should then align ourselves to. For instance, are these measures that have been adopted, do they provide, or are they carried out in accordance with the law? And specifically when we start with that, then we see that there is an issue in terms of compliance with the law. And I know Madam Commissioner had spoken to something close to this in terms of the government aligning, or rather ensuring that they are respective to the rule of law during this particular period. And I also want to talk about these particular measures being directed towards a legitimate objective, of course, in terms of a general interest, and that the prerogative being protection of health. And that is legitimate, or rather it is proper, because we've seen that they are trying to ensure that people don't succumb, and we've seen the numbers and what they look like. Another thing I would want to talk about is the necessity, or rather the strictness in terms of this particular adoption. Are they aligning to the democratic society that we live in? Are these things just copy-pasted, or rather picked from other entities and brought to us as Kenyans, and it does not fit? Have we seen anything to that effect? And yes, we have. We've seen, the implementation, or rather the adoption of certain practices that may not fit us, and they are quote-unquote geared toward protecting the people of Kenya. And the other issue I want to talk about is, are we enforcing these measures in a way that is least intrusive, or rather least restrictive, in terms of ensuring that we are attaining the objective of protecting people against, a very big number of deaths? I don't really think we've attained this, because the measures that we've used have proved to be very intrusive. We've seen officers arresting people in their houses. We've heard of cases of persons who are raped upon arrest during either curfew hours, or even probably because they were not wearing masks or flouting any other curfew rules. And the other one I want to talk about, the specific science evidence that has been used to inform some of these measures that have been adopted by the government. Yeah, because if we see that we have proper numbers, and then we have specific scientific backing to inform the zoning probably of a given area, or the quarantining of people for 14 days and other 21 days. And the other issue I would also want to talk about is, are we looking at the duration that we are enforcing these particular measures? Is it limited? Is it respectful to human dignity? Is it subject to review? And we've seen a review. Yes, we've seen a review. I mean, the other day we had that the curfew has been reviewed for another 60 days. Have we seen a review in terms of the police brutality cases? Have we seen comments or other statements talking about the measures, or rather the force that has been used? And this brings me now to the second issue of the use of it, or rather the use of the force that has been seen to have been used. We've seen people who are killed, we've seen people who are shot. And I'll go back to the National Police Service Act, specifically the 6th schedule. This indicates that there are instances a police can use force, specifically force or non-violent force. But generally, in terms of the cases we received last year, we had reported deaths as well as injuries in terms of use of excessive force. So having said that, then I go during and after COVID, period of after COVID. But before, there were glaring gaps. There were issues in terms of police brutality. Definitely there were cases, but this has been brought to the forefront during the implementation of the COVID-19. And there we saw staggering of numbers. And now where we sit today, 3rd June 2021, we are now faced with two things: the implementation of the regulations, or rather the measures to curb COVID-19 spread, and now we are faced with the electioneering process. We are already in that particular period. How do we balance this? Because we keep in mind that issues of police brutality have been very open in the past few elections. We do not want to talk about 2013 or 2007, 2008. We saw what happened then. Now we are here, we've seen what happened during COVID-19, and now we are already getting into the electioneering process. What then do we expect in terms of police brutality? And I know Vincent spoke about training and mobilizing resources to ensure that we enhance the capacity of duty bearers. And definitely we believe that also right holders need to know what their rights are and how best to ensure that these are implemented. And for that, I would recommend that we then, from this particular conversation, start looking around areas of prevention rather than responding, because I know we have been limited to simply responding. So then when we see a case of police brutality, we will go and offer medical support, psychological support, counseling, or maybe we go to court. How about we take a step back and say, okay, fine, we have seen this issue during COVID. We've seen this during both times. What is it that Kenyans, civil societies, government, stakeholders are going to do? And definitely that preventive approach is something that we may want to work hard towards. So then ensure that in as much as we're going through this period where we've seen very bad numbers of police brutality, we are hoping that they will drop through either advocacy measures, capacity building, and so on and so forth. That would be my comments for the very first set of questions posed towards me and Vincent. Thank you.
Thank you very much, Isabella. Commissioner Lucy, we want to give you an opportunity if you have something to add before we add another spanner in the works, so to speak.
clearly that we have seen action being taken against police in their brutality. We have seen police being taken to court, and we have seen them even being sentenced. And that should be on record, that due to our progressive constitution, we are seeing progress and human rights are being implemented. They may be piecemeal, but something is happening. And that is a point I want taken, that our courts are taking action against police brutality. Also, I want to state clearly that perhaps there is the need to know, do they really know that we have a constitution, we have the rule of law, and we have the implementers of the rule of law? Do they know that they should not go towards that direction of police brutality? And that is where, like our speaker stated clearly, we need to partner, and partnership is key. We need to tell them and tell them again, this is the consequence, this is the law, this is the mandate, and we must all live together in this country. We must fight pandemic together. Thank you.
Thank you very much.
If I
Yes, Isabella, you can come in.
Yeah, just quickly, a minute. Thank you so much, Madam Commissioner, for that particular noting. I want to reiterate that it is true there have been police officers who have been arrested and brought to book, in terms of various actions of police brutality. That is commendable. We've seen judgments so far. However, we would request that then the government moves with the same speed in terms of prosecuting and investigating and, of course, successfully bringing to book these particular perpetrators. We do not want it to be specific to certain small groups. We have seen instances where the government just goes quiet. Yeah, and we have seen that they have the muscle to both investigate and prosecute. How about we do the same for all these cases that are brought? And true, if we bring a person who has been accused and they are found not guilty by the courts of law, that is fine. We respect the rule of law, we respect courts, and definitely we want to adhere to their orders. If we have the same muscle, then how about we spread it across all the cases, definitely to deter any other activities of such nature, and to also set a precedent where the government says that if you act ultra vires, or rather you use excessive force in any given instance, we will do what we need to do in terms of investigating, definitely apprehending you, investigating, and prosecuting you accordingly. That was my comment. Thanks.
Thank you very much, Isabella. And just staying with you for a minute, Kenya in 2017 passed a law to have an independent forensic unit created. We are here, and I think that has not been done. This work has largely been done by IMLU so far. How has that been, and how does that relate to holding, police to account? And how has, what challenges do you face while, conducting this kind of work?
This particular service that you're talking about is specifically enmeshed under the Coroner's Service Act 2017 that was assented to. Up until today, the Act has not come into force, specifically because of some of the challenges due to drafting, as well as some of the requirements in that particular Act. And I'll speak to one. One of them being that there was a Coroner Service Commission that was supposed to be set up to set the office of the coroner. And without this particular service, then the Act itself is not able, rather, quote unquote, to pick up and be effective. I think yesterday we had a small meeting in terms of seeing how best to proceed. However, our last interaction with the relevant state agencies indicated that now there's a particular commission that is being set up, and we are hoping that that particular commission then will sort of accelerate, the enforcement of this particular act. And just to speak further to that act, you understand that the Office of the Coroner is being established to essentially push issues to do with inquests. Inquests essentially look at four things: who died, why they died, when they died, and how they died. The moment we are able to answer these particular 4 questions, we are able to either go to a criminal court or concurrently also go to a civil court. So in terms of addressing issues of police brutality, you understand that some of these cases end up in death. For instance, death in custody, or maybe someone has been shot in a crowd and you are told, oh, you know, this was a stray bullet. Or probably someone was brutalized or tortured and they die. So if it is not known exactly the circumstances surrounding this particular death, an inquest would be the next best step legally. So when this particular inquest is handled, say in a criminal court as it is currently, we have seen that there are some delays. And during this particular inquest, we have suffered something known as the Blue Code of Silence. The Blue Code of Silence specifically is an instance where the boys in blue protect each other. For instance, in terms of producing evidence that would be useful in investigation, or maybe any documentation or ancillary paraphernalia that would be useful in terms of ensuring that an inquest is successful, a specific person is placed at either the scene of crime or linked to a particular death, and then we proceed with criminal or civil prosecutions. So if this particular act is enforceable and it is useful and we have a coroner's commission, or rather a service, then we are able to know that the coroner's office is set up. And if it is set up, the manner in which we are going to be undertaking inquest will be very, very different from what it is that we do now. I want to appreciate that the courts are doing a good job, but definitely we will be more effective in terms of ensuring that inquests do not suffer the small legalities that we have been suffering. And we will be sure that in the event that we have an inquest, we are sure that we will be making some strides in terms of prosecuting these particular cases of deaths, specifically under police brutality. And I'm not saying that everyone who dies has been brutalized, but then that would be a question that is answered to an inquest. In the event that someone was maybe arrested and they had malaria and they died a natural death, but specifically in police custody, the inquest under the coroner's office will be able to show us that. So then we are able to separate that this was a natural death and this was a death that was caused probably by brutalization by a state agency. So that is something that we have worked on. I also, now that we're talking about this particular act, I don't know if you're aware of the Prevention of Torture Act that was also brought to book. Up until today, we have not had any charges specifically based on that act. We have also had some stakeholder engagement in terms of pushing for that particular act to be useful. And as a team, you know, through with other CSOs, we've also developed something known as the Rapid Response Guide, which will enhance the charge sheet. So then we are able to see prosecution specifically under that particular act. So Porter and the Coroner Service Act tied together will be a great step. Will be a very, very great step in terms of us ensuring that we see a reduction in numbers in terms of cases of police brutality and enforced disappearance. Thank you.
Thank you. Thank you very much. I'll yield the floor to my co-moderator to finish up on that theme.
Thank you very much for the opportunity. I'd like to go back to Vincent a bit on the issue of police brutality, and we've seen, you know, the establishment of the Independent Police Oversight Authority. We've also seen the establishment of the Internal Affairs Unit, which are, you know, which are independent organs that play a critical role in ensuring that the police perform their work with the use of minimal force and within the confines of the law. But we've also seen, you know, some level of interference in the works. And my question is a recommendation. What is it that needs to be done to ensure the independence of independent organs within the government or independent institutions within the government? And, you know, not limiting ourselves to, you know, the two that I just mentioned, but even others, you know, what can we do to ensure that level of independence?
Thank you. First, I'll respond to that question from two fronts. First is when it comes to institutions such as IPOA and IAU, I think they are doing well in terms of trying to investigate these police brutalities, and as the International Justice Mission, we engage with them a lot in some of the works that we do, and I think they are doing their level best. Of course, there is need to put in more resources into those organizations so that they can be able to get the necessary equipment that they require. They can be able to have the necessary resources required, because investigations are very expensive exercises. You can just imagine how much it would cost to conduct, say, 100 investigations of police killings. It's quite a huge amount of money, and therefore you require very sophisticated equipments for you to be able to preserve the evidence that would be required in court. On the issue of independence, what do we do so that we can enhance the independence of institutions? And you've said that not just limited to those two, but generally oversight institutions. I think in terms of what we can do, we have done the much we can. Because in the Constitution, we have given independent institutions constitutional power to be subjected only to the Constitution. In fact, if you look at Article 249, it provides that they are under direction or control of no power or authority. So there's nothing more you can do other than that in terms of giving them the constitutional threshold. The problem we have is something that we cannot legislate. And I remember some while back, I was asked to speak on that subject at Kabarak University. And this is what I said. You cannot legislate independence of the mind. Even if you give a constitutional commission all the powers like we have given them, or an independent office like we have given them in the Constitution, and even told them no one can direct you or control you in the Constitution. But if the holders of those offices decide that they will not be independently minded, if the holders of those offices decide that the office will become an offshoot of the executive, and they refuse to implement and to exercise the powers that they have been given by the Constitution, then it becomes difficult. It becomes difficult because we cannot legislate independent mindedness. And so I think for me, it behoves upon those who hold such offices to look at the law and see the powers they've been given and see the independence they've been given and perform those functions in accordance with the Constitution. That would be my response to that. Thank you.
Thank you very much, Vincent. You cannot legislate the independence of the mind.
That's very good.
The onus still rests upon the institutions and the leadership of those institutions to ensure the independence, because the power is already bestowed upon them by the Constitution. Thank you, Vincent, for reminding us the power that we hold in the authorities and the authority that we hold in the offices that we've been given and entrusted. I'd like to, as we move towards, winding this particular segment and move towards the Q&A segment, I'd like to give an opportunity to Commissioner Lucy, then I'll finish with Isabella. Commissioner Lucy, anything that you would like to add in regard to what needs to be done to strengthen the independence of our institutions?
Thank you. And I do agree that we have very good laws, starting with our Constitution and the mandate given to all government institutions, including independent Constitution and other government institutions. But I want to say that they can be challenged. We cannot just sit there and say that we leave it there. No. They are ways of challenging the institution and the way they are operating. One of them is definitely by filing a petition in Parliament. That one is well known. that if you feel that certain institutions are not working as expected, as per the Constitution and the law governing them, you can petition Parliament, and Parliament can take action. At the same time, if you feel that they are inactive, there is certain action which they are not doing, then you can also challenge that institution in a court of law. We do have a judiciary which can also push certain activities to be done through a court of law. And at the same time, we do know that these institutions do file reports in Parliament. We can also interrogate what they recommend in those reports and find out what is it that we have not done. And finally, I want to say that the citizens have a right which is enshrined in the Constitution, like I said, a right for them to wake up and challenge not just the independent Constitution, but every other institution of government if they are not performing their duties. That's what I can say. Thank you.
Thank you very much, Commissioner Lucy. Yeah, we have opportunities that we can take to keep institutions accountable. And you've rightfully highlighted some of them, and thank you very much for that. As we come to the close of this segment, Isabella, what are your feelings in regard to the independence of institutions in the country, and what can we do to strengthen that independence?
Thank you so much for that question. I was just listening in on what the other panelists were saying, and I think we are onto something over here. This is a very useful discussion in terms of just strengthening the independence. And I would want to simply talk about issues to do with resources and specifically budgetary allocations. We appreciate that there's a specific, or rather an important nexus between performance and independence as well as resources. Because if you want an institution to perform, for instance, IPO, and there are very many other institutions and authorities with specific mandates, if you essentially want them to perform as per, their creation or as per the statutes that formulate them, you then want to make sure that they're properly resourced, be it human resource, materially resourced, or what it is that they need in terms of ensuring that they perform their duties as need be. So when we talk about budgetary allocation, then we want to move away from politicization of budgets, or rather requests made by these particular authorities, be it independent or not. So once we move away from that, because these are institutions that are supported by the government, then we will be able to see a change. Recently, IMLO commissioned a study to look at the past 3 years in terms of how police budgets have been done, and we noted specific areas that definitely we will lobby on later in the coming year. And we noticed that there is a trend in terms of budgetary allocation, and specifically because, and we had spoken about this in the beginning of this particular discussion, that there is a link between the political body in the country and state agents, specifically the forces, so to speak. And now when you see that particular link, then you understand form budgetary allocation. Budgetary allocation then informs performance. Yeah, and then we'll go ahead to talk about issues of corruption and whatnot, but I will not go into that. So if we want essentially to make sure that these particular authorities perform and they're as independent as we intend for them to be, or even as the Constitution intends them to be, then we need to shift the ways in which we budget, or rather we allocate resources and funds for these particular authorities. That's all I wish to state for this one.
Thank you very much. As the saying goes, whoever plays the piper chooses the tune. So if we can be able to ensure there is independence in how resources are allocated to these institutions, and also independence in how the resources allocated are managed, then we can move towards a more independent institutions in our country. So thank you very much. We've seen a number of questions that have popped up from our listeners, so I'd like to invite my co-moderator to share some of those.
Thank you very much, James. We have several questions on the chart. The first question is, do the members of the panel think that corruption has watered down the efforts of the government towards the realization of the right to health? And the reference is to the AKMCC scandal. Maybe we could take two, you respond, then we do another round. So I'll read the next one. If the government is adhering to the rule of law, why haven't we seen the prosecution of the police who engage in police brutality and those who engage in the misappropriation of funds during COVID-19? I think we can, now that there are only three, we could just respond to all of them at once. The last one would be, how will or can AI be used to combat some of these pertinent issues like police brutality, and are there other reforms that are in place to combat police brutality? So maybe we could start with Vincent, if you may.
That question can be answered from many fronts. It's a very wide question because it brings to the fore so many. I don't take time. I'll just say that indeed corruption is an obstacle to the very scandal that the questioner is talking about. So we need to decisively come up with ways in which we can deal with corruption. I can tell you that in this country we spend so much money fighting corruption, money that can be used in doing other things, in money that can be used in development. But because we seem to have become experts in corruption, then we also have to put so much resources into fighting corruption. When you look at some of the countries that have very high integrity indexes, like Finland and Norway and Scotland, they use very minimal funds in fighting corruption because there's even no corruption to fight, and they have very small budgets that they have put in the institutions that fight institutions, because they are required to have them because they are members of the European Union. So yes, corruption in itself becomes an impediment, and also the lengthy processes that we have seen. For example, even when you talk about KEMSA, you find that the lengthy processes, people being taken to parliament, and we have other oversight law enforcement agencies that are investigating that. By the time that the people will be brought to book, if at all, then even prosecuting those cases in court becomes difficult, because when the cases take long to investigate, then you can just imagine what happens to the evidence. Yes, corruption is really an obstacle. Now, with the prosecution of the police, I agree with what I think it was Commissioner who said, that action is usually taken against police officers who have used excessive force or whatever. The challenge with such cases is actually that there is always cover-up from the very beginning. And so these are difficult cases, because remember, the standard of proof in court is still the same, and it is very high. So once a policeman does something and commits an offense, in fact, I remember, without going into so much details, one of the cases that we are handling is a case where the policeman shot a homeless man because of being outside past curfew hours. Now he's homeless, and he was saying that where you found me, is my home. And went and came back to now clear the scene of crime, and it was even other officers who were doing it. So the issue then becomes how do we operate in such a way that when such an instance happens, we can be able to quickly communicate. And this is where the issues of artificial intelligence comes in. How can we secure some of our streets? How can we, and all those things, so that we are able to preserve at least a record of what may have happened in a scene of crime. So that would be my response to those questions. Thank you.
Thank you very much, Vincent. Isabella?
Okay, so I'd like to answer the issue of tackling police brutality using AI. This is with an appreciation of the fact that technology is core in terms of responding to human rights needs and challenges. We've seen issues of fundamental human rights violations morphing from one thing to the other. Look at something like the Floyd case, and I know this gained so much traction in the media, and we saw that this particular case was captured on a phone. Right? This was a phone that brought this whole thing to the forefront. What does that say? If we are able to capture this data and probably segregate them through the use of artificial intelligence and other technological measures, who knows? We may be able to bring more people to book. We may be able to preserve our evidence. We may be able to even push for other legislations that we may not have in Kenya at the moment that would then inform probably the evidentiary use of technological capturings or gatherings in a court of law to prove or to disprove an alleged police brutality. So in terms of artificial intelligence, I think that's a brilliant question. And I'm hoping that as we go on in terms of ensuring that we handle all the different types of police brutality cases, we will also have at the back of our mind how useful technology has been. And I would also want to speak to how ILO itself handled matters to do with reports and processing, or rather even investigating issues of police brutality during the COVID-19 period. We heavily relied on technology because we consider ourselves, and I know most people in the civil society also consider themselves frontline workers. So we only had the option of technology having been thrown into an area where we didn't know what it even meant to work from home, yet you know that you have cases going on outside, right outside your house. So we relied heavily on technology, and if we had made proper use, or rather if we knew of avenues where artificial intelligence would be applicable, I'm thinking we would be very, very far, considering the fact that at the moment data is looked at as probably more valuable than oil, and people are saying it's even more valuable than gold. I don't know how true that is. So AI tied together with technology and then link it to the protection or rather prevention of any human rights violation would be a core subject for us to look at going forward. And this is with an appreciation that technology will not be something that we can get rid of if we want to adequately respond to human rights violations, specifically police brutality. And also keep in mind that if we made use of artificial intelligence systems, for instance, in our National Police Service and other avenues, we would be able to disintegrate either scenes of crime, keep data that we may need, and probably this data would be accessible to entities that may be investigating a case of police brutality. Vincent has alluded to the issue of cover-up by police officers, and I had also spoke about the same previously, what we call the blue code of silence. So if we have AI and we use it as we should be, or rather craft it to cover the cases that we have as a society, or rather as a country, then I think we would be probably getting through to some of the issues that we face in terms of either holding people accountable or bringing them to book.
You bring an interesting point, because there has always been a push and pull between technology and enforcement of human rights. And while it's easier and it fastens the process to hold individuals accountable, the counterbalance of it is it looks like a lot of state power when it's released to the wrong hands. So that is an interesting conversation I think we might want to have. And just to maybe allow Miss Lucy to give her comments, and then we can conclude.
I just want to agree with Isabella and Chahal. That is the way to go. I can only add that we can use access to information to fight corruption. This might increase transparency and accountability because it allows journalists to carry out investigative journalism. It can also allow civil society to ask questions which otherwise they would not ask, using active disclosure by making minutes. We can also use access to information to fight police brutality, whereby the citizens themselves can ask question and continue to ask question. Why, and what can we do as citizens? Should we just wait? Can prosecution take place? Which laws can we use to fight police brutality? Then on the other side of police, we can educate them on access to information and tell them that they need to be more accountable. Otherwise, the law will catch up with them. That's all I can say. And in artificial intelligence, I think this is an area and the access to information we need to add. We need to use so that we can provide information to citizens as and when is required.
Thank you very much, Commissioner. Thank you very much, panelists, for availing yourselves to participate in this panel and for the discussion we have had. I just want to maybe give you a minute, each of you, to make your closing remarks, and then we can conclude the panel. And again, I'm sorry, but it appears we'll start with you, Vincent, again.
Thank you very much, and it's a pleasure for me to have joined in this conversation, and I've enjoyed listening to myself. I want to thank you for the invitation, and also to thank my fellow panelists, the Commissioner and Isabella. In my conclusive remarks, I can just say that it behoves all of us, because this country belongs to all of us. It behoves all of us to take it as our personal responsibility to see how we can assist our country, how we can develop our country in terms of all these things that we've talked about. Whereas we have government, and we place that primary responsibility to government institutions, but we then still have a civic duty as members of this republic to see to it that we put government to account, and to see to it that we put ourselves to account. Because even all these people employed in government are Kenyans. They are chosen from amongst us. Yeah. And so to me, sometimes when we talk about these issues, it points out to a societal problem, because however much there is a turnover in government institutions, and we still see some of these things, then it means that there's a societal problem that we must tackle. The policemen we are talking about are Kenyans. They are appointed from amongst us. So if they do these things, then it points to a larger infraction within our society, and it behoves all of us to see to it how we can deal with that, even as we educate better the upcoming generation. So thank you very much, and good afternoon.
Thank you very much, Vincent. I'll go to Isabella.
Thank you so much for this opportunity. I want to thank KUSOL and AKMCC for having us. We are happy to have partnered with you. It's very refreshing to just engage in this particular discussion, as well as to know that we are reaching out to students who, have the potential to then come and join the workforce in various areas to help in preventing, or rather ensuring, that human rights are upheld. And for me, my closing remark would be to just ensure that we also do not forget that this particular discussion has been limited to various facets of maybe either our areas of work or issues that we've interacted with closely. I know with the coming of COVID, there have been various layers of issues that we may not even be able to cover were we given a year to discuss, because there are mental issues, economical issues, and so many other things such as GBV that probably we may not have adequately covered. But given the time and our areas of expertise, we may have limited that to a given type of discussion. And as I conclude, I would also just want to talk about the fact that we need to ensure that we hold each other accountable, even as civil societies, in terms of our partnerships, in terms of our collaborative areas, and in terms of resource allocation. I may not be able, probably as INLU, I may not be able to take up something, but another entity is able to take up something. Are we able to collaborate to just ensure that we are responding and preventing various facets of human rights violations? And another thing I would want to talk about is innovation. I spoke about the electioneering process as well as the COVID-19 time. And if we are able to be innovative enough, we may be able to capture the crisis that we normally want to call the twin crisis that may be facing Kenya as we speak right now. So if we are going to be innovative, if we're going to use whatever it is that we can use to ensure that we prevent rather than respond, that would be a great thing. And in terms of partnerships, are we able to then look at sustainable partnerships? Because I doubt any entity would work by itself, be it government, be it civil society. COVID-19 has just shown us that. So are we able to partner, and in what way are we partnering? Are we going to structure? Are we going to limit it to a given area of maybe distribution or performance? That is left to us. And that does not mean that maybe civil society is better than government or government is better than civil society. No. If we have areas of collaboration, then I think that's something we need to look at. So that being put on the table should then maybe ensure that we are working for the same cause. Our prerogative is human rights, with or without COVID. Thank you so much.
Thank you very much, Isabella. And finally, Honorable Commissioner, you can have the last word.
For having requested us to speak with Isabella and Chahal, we are truly grateful. And to say that this has been an eye-opener to me as a commissioner, that we need to do more, we need to engage more, and to discuss issues that pertains to our mandate and that can address Kenyans in a better way. I also want to state clearly that as a country, we are heading to a very difficult year, the year of elections, and access to information can be used by all Kenyans to ensure that we have a year and that development will continue to go on even as information is provided as and when it's requested. Further, I want to state that there was a question on vulnerable groups, that is women and girls, who are truly affected even by corruption and police brutality. And as a commission, we have highlighted the group, and we are working to ensure that they get access to information because they are disadvantaged. They are at the rural level. They do not have access to information using the normal platforms which we know, yet they are truly affected by what we are discussing today, including COVID-19. So as a commission, I want to assure you that we are going to mashinani and we will help the marginalized, including women and girls, to access information as and when is necessary. And thank you very much. I look forward to partnering with all of you present. Thank you.
Thank you very much. Just a couple of words from me. First of all is to thank the All Kenyan Committee for inviting us to moderate this panel. Also to thank the panelists for creating time, for spending almost 2 hours of your time with us this morning. I am truly grateful for the time, for your insights, and for your openness to this discussion as we've had. To the participants who've been with us all through the 2 hours, we are thankful, even those that dropped off at some point. I want to thank you for participating in this discussion, and we hope that we'll have a more robust discussion even as we go by on the issues that affect us. This is our country. We have to fight for it. We have to talk about it, and we have to defend it from internal and external attacks. I'll give a chance to my co-moderator to give his final remarks and conclude the panel. Yes.
As my co-moderator said, thank you very much to our panelists. We apologize that Zipporah wasn't able to join us. However, for the panelists that were able to join us, thank you very much for the great opportunity to share your wisdom and insight into this conversation. To the hundreds of listeners who are watching us on different platforms across the globe, thank you very much for creating time to be part of this conversation. And as we close, we have been fed this narrative that we need to have collective responsibility to the rights of each other, which is a good narrative, but it does not exonerate the government from its obligation to fulfill, protect, and promote human rights. Those are my final remarks. Thank you.
For the past 8 years, the All Kenyan Moot Court competition has been keen on pushing the conversation on human rights within the Kenyan context. Through conducting various moot court competitions centered around human rights issues happening in Kenya, we've been able to engage with various stakeholders and, most importantly, law students from across the various universities countrywide to steer human rights discussions among students. This year will not be any different. Even with the COVID-19 pandemic that has changed what would be the old order to what is the new normal, we will hold our conference and moot court competitions to push the conversation around health and corruption, with a key focus on the Article 43 right, its realization, government response to the COVID-19 pandemic, and the malignant cancer of corruption that has over the years crippled the Kenyan healthcare sector. Join us virtually from the 2nd to the 5th of June 2021 as we discuss the theme, Combating Corruption in the Attainment of the Highest Attainable Standard of Health. All are welcome.